Today we are talking with Dr. Elena Rios, President of the National Hispanic Medical Association. Dr. Rios, tell us about your conference in Washington, D.C. this April, Advancing Hispanic Health the Next 20 Years. What is the goal of this conference and why is it important?
Well, the goal of our Hispanic Health Conference is to bring together the National Hispanic Medical Association and the Hispanic Dental Association for the first time in this country so that we can share the expertise of our providers who know the best how to treat Hispanic patients.
Okay. Who is attending the conference and what type of events will there be?
We have medical students, dental students, as well as residents, lots of doctors and dentists, and government and healthcare industry experts, all interested in sharing their knowledge about Hispanic health. Events are going to happen starting Thursday, April 21st. We're having a special research training for 26 junior faculty from across the country to learn how to write grants for NIH. We're meeting with Congress members. We have Capitol Hill visits to do advocacy meetings. We have about 50 meetings planned so that we can take doctors and dentists to tell our congressmen and our senators what's important for us in Capitol Hill in terms of legislation. And we also have a gala awards dinner on Saturday night where we will have awards presented to many different doctors and dentists as well as dance. And we also have community service events, including vans to check vision and dental care for the community.
Why does the richest and most medically advanced country in the world have such health disparities, especially in the Latino community?
Well, the United States has not had insurance for everybody, and that's really the major financial reason why we have disparities in our communities. But there's many non-financial reasons, including culture and language. The healthcare system is just not as relevant to Hispanics who are very close to their countries, very close to their families, and need more culturally focused programs in our hospitals and clinics, nursing homes. And so that's why we think it's important to have a sharing of ideas that can change our healthcare system.
What are 3 things that can be done today to close this health disparity gap in our community?
Well, healthcare disparities are not going to be changed overnight, but we believe by educating more people in our community, the caregivers of the elderly who are the most sick, educating young people that they need to lead healthy lifestyles through prevention programs, especially for healthy weight and nutrition and physical activity. And I think the other thing really is how do we get more people to understand what insurance is, healthcare insurance, why they should buy healthcare insurance, and especially we need to create affordable health insurance plans so that our families can afford them and the employers in our communities that are small business people and doctors and dentists and their practices can afford to provide health insurance. So I think if we do all of that, the last thing I would say that we really do need to have more Hispanic doctors and dentists and nurses and public health leaders. We need to be on the boards of directors of our hospitals and in our communities, and so that we can make changes that are most relevant to closing the gaps.
What challenges do you see in closing the health gap in the U.S.?
Well, I just mentioned the major challenge is really leadership. It's political will. This country has spent a lot of money on the medical side of things and treating acute care instead of spending more money on educating our communities about prevention so that we don't have all the horrible diseases come so fast and come so early in life, so that we can have healthier adults. The major challenge really is that if we don't do this, we're going to have a lot more sicker younger people faster. Obesity is a big challenge for us, for all of us, and obesity leads to lots of chronic diseases, so I think that's one of the major challenges.
What if the ACA is repealed? How will this affect the U.S. Latino community and other underserviced communities?
Well, the Affordable Care Act was the most transformative law that we have had in this country since Medicare for the elderly and Medicaid for the poor in the 1960s. So if the Affordable Care Act is repealed, for the Latino community, it's going to be devastating. We aren't going to be able to have insurance that's affordable. We won't be able to have funding for prevention programs. We won't be able to have money to recruit more students to think about going to health profession jobs and careers. And there's just, I think it's just going to be a horrible quality of life as more people that would have had health insurance won't have the ability to go see a doctor or get health care services, and will continue to live their lives with disabilities and with major chronic diseases that aren't going to be treated.
Could the government do more to improve the health of diverse communities? How and why?
The government can do a lot to increase the health of our communities in diverse areas of the country, especially putting money into public health education and media programs, social media programs, and also mentoring of the young people in middle school and high school so that they understand that there are role models among our communities. We have health professionals that are that they can learn from, learn to go to college and apply to medical school or dental school or nursing school. And I think that the government can provide more funding through STEM, especially the STEM programs, the science and math programs, and those are the students that could apply to become health professionals. And the government can also help with more jobs created in the healthcare industry because we have so much of a need for Hispanics to be in the healthcare industry.
Are medical costs out of control in this country? Are we paying too much for prescription drugs, medical and dental care, and ambulance service? If so, why?
Medical costs are very, very high, and I think 17% of the economy is because of healthcare costs of all kinds. I don't think it's just one part of the healthcare system. It's not just hospitals or prescription drugs or doctors' costs. It's everything combined. And yes, I do think we need to have more affordable health insurance so that more people can afford to live healthier lifestyles and go to the doctor regularly. And yes, I do believe we should cut down on costs of prescription drugs so that people will be able to afford them and actually be treated for their diabetes and high blood pressure and high cholesterol and all the other issues that we have.
Thank you, Dr. Rios. What are your closing thoughts?
Well, I think in closing, I just would like to say that our national conference, Advancing Hispanic Health for the Next 20 Years, is the first time that we bring together the National Hispanic Medical Association and the Hispanic Dental Association. And we're very proud to work with our partners. Our major sponsors this year is Centene Corporation and the Cancer Treatment Centers of America, Anthem, Pfizer, PCORI, and many other, especially for the Hispanic dental side, the Colgate and Crest and other oral health companies. So we're very proud to work together, and we want to invite the Washington, D.C. Local health community leaders to come to our conference at the Renaissance Hotel on April 21st through the 24th. And you can get more information at our website, www.nhmamd.org. Thank you.